For my STEM project, I will be presenting a pediatric surgeon. What is a surgeon? A surgeon is a physician who performs surgical operations. In other words, a surgeon is a physician who cuts the human body in order to treat diseases, injuries, tumors, transplants, and furthermore. Surgeons can have a variety of skills that allows them to create a combination of workplace setting. Surgeons can become a general surgeon, which means they are able to operate all types of surgery, or it can be specialized and focused on one certain field, for example, a pediatric surgeon who works with children, a cardiopathic surgeon who works with the heart, and a neurosurgeon who works with the brain. What is a pediatric surgeon? A certified medical doctor who performs surgery on infants, children, and teens with medical issues such as leukemia, cancer, and problems with the appendix. What is a pediatric surgeon? In a further meaning, a pediatric surgeon is concerned with the diagnosed, post-operative, operative, and post-operative management of surgical problems in children. Pediatric surgeons consult with other surgeons depending on the children's medical problem in order to determine if operating is the right solution. They participate in transplantation operations as well as using laparoscopic techniques for some operations. Pediatric surgeons have certain expertise and responsibilities such as neonatal, prenatal, trauma, and pediatric oncology. The education necessary to become a pediatric surgeon is that you may need a high school diploma, continue on to a 4-year college or university, and earn a bachelor's degree in pre-medicine or a scientific related field, such as in biology or chemistry. You also need to volunteer. You also need to have volunteer experience at a hospital. Also, for years of medical school, complete 3 to 7 years of internship and residency programs. Pass the 3-step United States medical licensing examination and become a board certified doctor. How to get a job as a pediatric surgeon? As said, it's basically the same as education. But you need a bachelor's degree in pre-med or scientific field. You need to go to medical school, earn a medical degree, complete a residency and fellowship, become licensed, and become board certified. The day-to-day activities of a pediatric surgeon. So basically, they cooperate with radiologists, use ultrasounds and other technologies during fetal stage of a child's development to detect any abnormalities, plan corrective surgery, educate parents on before baby is born. Pediatric surgeons are routinely faced with critical care situations involving traumatic injuries in children. They are involved in diagnosis and surgical care of children with malignant diseases. Pediatrics communicate and socialize with the patient. They go to surgical neonatal intensive care unit to make rounds and touch base with their team of excellence, and they experience surgical nurse practitioners. Interesting aspects of the job. So pediatric surgeons help save the lives of many ill children. They interact with children. Their salary is $462,801. They have life insurance. They work in teams to help find a solution and work with newborn babies. That's it for today's presentation. Thank you so much.